Hi, my name is Maria Ramos, and I will be a senior at Holy Name High School in the fall. This summer, I was a nursing intern in rehabilitation therapies at South Point Hospital. My project involves using demographics as an indication of a lack of balance in back pain patients. The purpose of my research project was to discover major factors that could lead to a high risk of falling in back pain patients. The results of the study will help physical therapists create a physical therapy program that could target the improvement of the quality of life in patients with these morbidities. Hypothesis. Upon review of the charts and the patient's demographics, the majority of the study population will be obese or overweight. Being overweight or obese will be most visible factor that could lead to a high risk of falling in back pain patients. Methodology. Short-form Berg balance scales that were completed at South Point's physical therapy unit were collected and a study population of 15 patients who had back pain and a high risk of falling were gathered. The physical therapy patients' charts were collected and then reviewed so that the presence or absence of certain diseases or complications could be recorded. Certain demographics, such as height and weight, were looked up in the patient database and were recorded. The patient's individual heights and weights were then put into a calculator on the National Heart, Lung, and Blood Institute's website to yield the patient's BMIs. The BMI values are then used to determine the patient's weight class. All of this information was recorded on a spreadsheet, and the diagnoses were analyzed so that a pattern may be revealed. The Berg Balance Scale is an assessment that numerically measures patients' risk of falling and their ability to maintain balance. The 7-item short-form version is more commonly used in a physical therapy unit rather than the original 14-item long version. The Berg Balance Scale measures how independently and how long a patient is able to reach, walk, and stand. Each individual step on the Berg Balance Scale is scored on a scale of 1 to 4, depending on how well the patient can perform each exercise. The higher the score for a step, the better the patient can perform the exercise. These individual scores are then added together to yield a total score out of 28. If the patient's score is below 23, the patient is at a high risk of falling. Some of the exercises that are on the short-form Berg Balance Scale include standing from a sitting position, standing unsupported with one's eyes closed, and reaching forward with one's arm outstretched while standing. Some exercises, such as the one described in Step 3, involve scoring based on how far a patient can reach. The scoring on other exercises, such as the ones represented in Steps 4 and 5, are based solely on accuracy. Still, other exercises, such as the one described in Step 7, is scored based on the length of time a patient can hold a certain position. When gathering the study population, 60 short-form Berg Balance Scales that were collected at South Point's physical therapy unit were collected. 44 of these scales had a score of 23 or below, and thus had a high risk of falling. The charts of the high-risk patients were then reviewed to determine whether or not the patient suffered from back pain. Review of the patient's medical history forms revealed that 15 out of the 44 high-risk patients had back pain. The results showed that 74% of the study population was considered overweight or obese based on their BMI. The remaining 26% of the population was considered to maintain a normal weight or were considered to be underweight. The results further showed that 11 out of the 15 patients that were used in the study suffered from hypertension. The presence or absence of diabetes, osteoporosis, rheumatoid arthritis, lumbar spinal stenosis, osteoarthritis, and cancer was reviewed in the patient's charts. The results revealed that 3 patients were diagnosed with diabetes, 3 patients were diagnosed with osteoporosis, and 5 were diagnosed with rheumatoid arthritis. Furthermore, 4 patients suffered from lumbar spinal stenosis, 2 patients had osteoarthritis, and 5 patients have suffered from cancer. In conclusion, body weight proved to be the most visible trend in seeking factors that put back pain patients at a high risk of falling. The results revealed that being obese or overweight is a major contributing factor in putting a patient at a high risk of falling. The high percentage of overweight in obese patients corresponds with the large number of patients that have high blood pressure. The results might have been different if there was a bigger study population to work with. Using a larger population might have shown that the certain diseases and complications that were focused on in this research actually play a more substantial role in putting a patient at risk of falling. In an effort to decrease a patient's risk of falling, healthcare professionals should continue to encourage their patients to maintain a healthy diet and exercise regularly. The Cleveland Clinic should also continue their efforts of increasing community awareness by hosting appealing fitness events and health fairs. As one of the nation's most recognized hospitals for community engagement, the Cleveland Clinic should continue to hold lectures that address balance and the dangers of obesity. In order to decrease their risk of falling, patients should also make it a habit of regulating and monitoring their blood pressure. Here is my abstract. Here are my references. I would like to thank my mentor, Carol Snyderwine, and my co-mentor, Rick Kinzer. I would also like to thank Lisa Higginbottom, Linda Pasek, Carol Weber, and my partner, Brianna Sloan. I would also like to thank Outpatient Rehabilitation Therapies, the staff and administration at South Point Hospital, and the Cleveland Clinic Office of Civic Education Initiatives.